the cecum, pain and tenderness may be felt in the lumbar region. If it's deep in the pelvis, these signs may be elicited only on rectal exam. Yeah. So pain on defecation suggests that the tip of the appendix is resting against the rectum. Pain on urination suggests that the tip is near the bladder or impinges on the ureter. Some rigidity of the lower portion of the right rectus muscle may occur. Then Rovsing sign may be elicited by palpating the left lower quadrant. Ile ndio inakuwa referred to like una feel pain kwa like ukipalpate the left lower quadrant uta feel pain huko kwingine on the opposite side. So this paradoxically causes pain to be felt in the right lower quadrant. Yeah, exactly what I was saying. So ukipalpate the left lower quadrant, you'll feel pain in the right lower quadrant. So that's what we call Rovsing sign. So if the appendix has ruptured, the pain becomes more diffuse. Abdominal distension develops, rupture, the pain becomes more diffuse. Abdominal distension develops as a result of paralytic ileus. Yeah, unajua paralytic ileus ni nini? And then the patient condition worsens. Then constipation can also occur with an acute process such as appendicitis. Laxatives administered in this instance may produce perforation of the inflamed appendix. So in general, the laxative or cathartic should never be given while the patient has fever, nausea or pain. Juu huwezi kuwa una nini, huwezi jua kama it's a ruptured appendix. Wow. Sawa, so thank you for the evidence. Tunaweza siti sasa. Siko wadibo anze. Ruki, uniski? Wow. Ruki, unanisikia sasa? Oh. Haoni join icon Manoa. William amsaidie. William kindly help that person. Anajiita WC admin. William anamsaidia. Ruki, hebu niambie kama unanisikia sasa. Huyo dogo kashindwa kujoin jamani. Haoni nini the join icon. Okay, sawa Ruki. We are good now. 37 says the immunological reaction to chemicals in cosmetic or poison ivy is category allergic or anaphylactic reaction, cytotoxic reaction, immune complex mediated reaction, and delayed type hypersensitivity. Wow. Kumbuke nayo. Immunological reaction to chemicals. Dictator nene na A, Mami Queen A, Britney Allure A, Rhythms A, Laisha Ouma A, Humpy B, Survivor A, Bob A, Manu A, Marietta A, Miss Feli A, Rita A, Sandra D, Niel A, Dirasip A, Sifuna A, Aisha D. So far we have A, B, D. Evidence. Yeah, evidence itume Aman is going with A. So what are the types? The 4 types of hypersensitivity reactions ni gani? Nakwanga 4, si ndio? 4 types of hypersensitivity gani? Mtukumbushe hapo kwa delayed. The first one ni gani? Yeah, people type anaphylactic, yeah, si ndio? Anaphylactic ama allergic ndio type 1, si ndio? So anaphylactic is IgE mediated, si ndio? So this is one that occurs as a quickly after exposure. Na inakuwa found in like vitu kama allergens. Yeah. For example, umeumwa na nyuki. Yeah. Allergy to maybe drugs like mostly penicillin. Yeah, ina cause type 1 hypersensitivity reactions. Kuna evidence already. So bee stings, latex, certain medications like penicillin kwa type 1. Type 2 ni cytotoxic ama antibody mediated cells. Cytotoxic ni T cells, ndio? The CD8 cells. So this one we find in hemolytic reactions. For example, blood transfusion. This is the type of reaction that you can find in blood, like during blood transfusion. It's mediated by antibodies. Sawa. And then Wood-Pasture syndrome, hiyo ni gani hadi sijui hiyo. Then we have hyperacute graft rejection. So hiyo pia ni a type of cytotoxic hypersensitivity reaction. Type 3, we call it immune complex reactions, where the immune cells, antigen, antibody, blood infection. Then type 4, that is delayed or cell-mediated hypersensitivity reaction. So type 3 ilikuwa ni antibody mediated. Type 4 ni cell-mediated in the cells. Okay. So here we find it in chronic graft rejections. PPD test. PPD test ilikuwanga purified protein derivative. Ile yenye tunapatana kwa tibu. Evidence from so allergen specific IgE antibodies bind to mast cells via the Fc receptor. When the specific allergen binds to the IgE, cross-linking of IgE induces degranulation of mast cells. So example, we have local and systemic anaphylaxis. Tunajua examples zile kama nini, hay fever, food allergies, drug allergies kama penicillin, IgM. So these are cell-bound antigen. IgG or IgM antibody binds to cellular antigen, leading to complement activation and cell lysis. IgG can also mediate ADCC. In full with cytotoxic T cells, natural killer cells, macrophages na neutrophils. So the example ni kama red blood cell destruction after transfusion with mismatched blood types or during hemolytic disease of the newborn. Yeah. So activate the complement system. They provide inflammatory mediators and recruits the neutrophils. So enzymes released from the neutrophils damage the tissue. Tissue damage. So here we find it in post-streptococcal glomerulonephritis. Then rheumatoid arthritis na SLE. Type 4, now your T cells. What the cell-mediated type of hypersensitivity reaction. So it's soluble or cell-bound antigen. The T helper 1 cells secrete cytokines, which activate macrophages and cytotoxic T cells. So we find it in contact dermatitis, maybe a poison ivy, type 1 DM, multiple sclerosis. Sawa, thank you for the cities. Mnipe cities hiyo swali. So CTD is very correct, very direct from the evidence. So nataka kushikika kidogo. William, unaweza nishikia kidogo?
Nilikuwa nataka nipe Black, sijui kama ako hapo. Of a client with Guillain-Barré syndrome is A. Symmetric paralysis, B. Tachycardia, C. Increased peristalsis, D. Amnesia. So we have A from Rocky, Brittany. So kila mtu ameenda na A. Let me see. That is a systemic symmetric paralysis. The finding that so that we digest, we put Guillain-Barré syndrome. Anyone? You guys don't have evidence. You don't have notes on Guillain-Barré syndrome. So we have an insight from Emma. It is a disorder in which the body's immune system attacks the peripheral nerves, leading to muscle weakness and paralysis. Thank you very much, Emma, for giving that insight. So demyelination from bottom up. Okay, thank you very much, Black Portion. So we have an evidence by Black Portion that is on Guillain-Barré syndrome. So it is an autoimmune attack on peripheral nerve myelin. The result is acute, rapid, segmental demyelination of the peripheral nerves and subcranial nerves, producing ascending weakness with dyskinesia, that is inability to execute voluntary movements. Then you have hyporeflexia and paresthesis, that is numbness. So at an antecedent event precipitates clinical presentations. So we have various causative agents, inclusive of HIV, are the most common infectious agents that are associated with the development of Guillain-Barré syndrome. These are statistics. More evidence. Can you kindly share more? Oh, thank you, Bintul Fak. So Guillain-Barré syndrome, it is an autoimmune disease where the body's immune system attacks the peripheral nerves, leading to muscle weakness and paralysis. So we have affects the peripheral nervous system. Risk factors, it has no known cause, but we have others like recent infection, recent vaccination, recent surgery, recent injury or trauma, Hodgkin's lymphoma. On the pathophysiology, we have antibodies attacks peripheral nerves, myelin sheath and nerves get damaged. Nerves are unable to send signals. So you note the pathophysiology from the evidence there. Also, we have some pictorial evidence on the same. Symptoms, acute onset and ascending muscle weakness. Maximum weakness reaches in 2 weeks. Note that. So we have tingling or numbness in extremities, loss of reflexes, difficulty breathing or swallowing, progressive muscle weakness. This begins in the lower extremities and progresses upward bilateral. So on diagnosis, lumbar puncture, the tests cerebrospinal fluid for higher than normal protein levels. So higher protein in CSF may indicate antibodies or inflammation. So we have electromyography, tests nervous function. Then we have nerve conduction studies, measures speed of nerve signals. On the treatment, we have plasmapheresis, that is filters unhealthy antibodies from the blood. We have intravenous hemoglobin, infusion of healthy antibodies. We have symptoms management with analgesics for muscle and joint pain, anticoagulants for VTE, that is for paralyzed patients. Guillain-Barré syndrome is self-limiting, but severe muscle paralysis can lead to respiratory failure. Note that. You should note that. So on the nursing interventions, you focus on the ABCs: monitor breathing, chest physiotherapy, keep head of the bed elevated, anticipate need for mechanical ventilation. Then you have VTE prophylaxis. Then you have supportive care as the last thing, range of motion exercise, reposition every 2 hours. We have TPN or tube feeds if swallow impaired. Yo, are we together? Ongea venye huwa una type. Okay. I speak my words. Let's continue. We have more evidences, but I think I have covered a better part of it. So for the rest, is there any evidence that is that have more information? We have an evidence shared by Redams. Thank you very much. He has shared something also on Guillain-Barré syndrome. That is on the symptoms of Guillain-Barré syndrome. We have movement and things such as breathing and heartbeat. It usually affects your arm and legs first before you get symptoms in other parts of your body. Symptoms usually get worse over the first 2 to 4 weeks. You might feel tingling, numbness, or pins and needles in your feet and your hands. So this is usually followed by muscle weaknesses and difficulty moving a joint. So we have more symptoms, that is sharp shooting pain, often in your legs or back. You have problem breathing, problems with your face, such as drooping face muscles, and trouble swallowing or speaking. Problems with your eyes, such as double vision. Thank you. So on the diagnosis, we have if you have symptoms of Guillain-Barré syndrome, your GP will check your reflexes and will check for any numbness or weakness in your muscles. If a GP thinks you have Guillain-Barré syndrome, they'll refer you to a specialist in nerve conditions for test and treatment. You may have tests such as an electric test of your nerves and muscles, a breathing test, that is a spirometry, you have blood test, and you do a lumbar puncture. I think most of the things I have covered. Most of the things. Oh, thank you, Ken. So VTE is venous thromboembolism. Thank you. Oh, you have already given me cities. Kindly forward the next question. I think now you have an idea or more idea on Guillain-Barré syndrome. Kindly forward the next question. Yes. Thank you for the evidences. Forward the next question. Thank you. The next question is number 39. The increased advocacy for non-antibiotic management of infantile diarrhea or the increased advocacy for non-antibiotic management of infantile diarrhea is a result of scientific evidence that A, most infections are related to gastrointestinal irritation. B, viral agents are the leading cause of those infections. C, teething problems are associated with the diarrhea. D, contamination of food in preparation and handling result in infection. So number 39, We have B, 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 B. We have B from most of you, if not all of you. All of you are going with B. All of you are going with B. All of you are going with B. What does B say? Viral agents are a leading cause of those infections. So the increased advocacy for a non-antibiotic management of infantile diarrhea is as a result of scientific evidence that viral agents are a leading cause of those infections. Do we need evidence? Oh, we had tulishafanya hii paper kwani? Ama what do you mean? Oh, the question is repeated. The question is repeated. So the scientific evidence showing that infantile diarrhea is mostly caused by viral infection is the reason why they introduced immunization with the rotavirus. Is it so? Yes. At what age, at what week do we give it? Which month, which week? Treatment mostly oral rehydration, supplement, and zinc. Yes, that is correct. So rotavirus is given at 6th, 10th, and 14th week. Thank you very much, Emma, Lily, and Mommy Queen. Wanaume mmepotea. How many doses? Who is this? Humpy Humps. We don't encourage using AI. So we don't encourage using AI. What is the dose? The dose, we have 3 doses. What is the maximum age for rota? So you give 5 drops in 3 doses. You give 5 drops, 3 doses. What is the maximum age for rota? 6 months. I'm not sure, but you can confirm. If you are sure about it, you can confirm. 1 year. Is it? I'm seeing very different opinions from you guys. Somebody to check that and let us be sure about it. Oh, it is 6 months. Si tuendelee sasa? Tuendelee ama tusiendelee? Yes, if you have the guidelines, kindly share. Should not go beyond 1 year due to risk of. What is the risk involved if you give it to children, to over 1 year olds? What are the risks involved? If you have the guideline, kindly share. It is good to draw the insights from the evidence. There is a time when it was not available. So KP came and said we give until 1 year so that we cover damage of gut flora. Jamani. Overturning of intestines, nimesahau medical name. Okay, just go and do research alafu utatuambia, si ndio just a baby? Huyu ndio just a baby ama huyu ni mwingine? Just a baby, you can go and do more research, then you will tell us. Thank you. Next question is number 40. Deficiency of folic acid in the first trimester of pregnancy is associated with the development of EPI, I think, to define. So everybody is going with B, that is spina bifida. Hiyo simnipesiti jamani. Thank you for the CTs. Thank you very much. Ni nyinyi tu ndio mnafanya hii group inasonga. Ni nyinyi tu. Oh, we have something shared here by Black Potion. Thank you very much, Black Potion. So she has shared something on rotavirus vaccine. So you can go through it and be sure of the various. You can see the overview. Kuna hii point hapa ya children under 1 year. Somebody asked why we should not go beyond 1 year. But I think atatuletea hiyo evidence baadaye. What of cleft palate? Oh, there's something here shared by Sabigal. Thank you, Sabigal. This is on Phocomelia. Remains the most striking limb deformity caused by thalidomide and remains the stereotypical image of thalidomide embryopathy. Majina ni moto hapo. Phocomelia occurs through a severe shortening of the limb due to proximal elements being reduced or missing. Thank you. Thank you for sharing that. What of cleft palate? Let me see. Cleft palate ilikuwa kwa choices. Oh. So we have before we proceed to number 41, kindly before we proceed, we have an inquiry from Holette. So Holette is asking what about cleft palate, cleft lip and palate? Or for Folic, we are going for neurotube defects. Holette, were you asking whether cleft palate could be the answer, or what was the question? Oh, you are asking the causative agent, the causative or the risk. There are no direct correlations with folate deficiency. But you can share something for the sake of that, because now we have a concern. Mimi pia siko sure. You can share something on cleft palate so that we be sure about it. So meanwhile, we can sit in. So somebody to share something on cleft palate. Hakuna jamani, hakuna. Thank you Nila. So cleft lip and cleft palate. So this is a congenital defect causing opening or splits in the upper lip. So we have splits in the upper lip, roof of the mouth, or both. We have variations of both cleft lip and cleft palate together. Risk factors, we have genetics, can inherit part of the gene from either parent. We have intrapartum infection, use of tobacco, alcohol, and drugs while pregnant, vitamin deficiency, folic acid. Oh, so it is a factor. It is a risk factor. Palate inafuse at what gestation? Swali inauliza trimester 1. The question, according to Manu, the question might be mostly, wait. Some anti-seizures drugs like valproate cause cleft palate. So thank you for sharing this evidence, Sabigal. I think we have seen that folic acid is a risk factor. Folic acid deficiency is a risk factor for cleft and cleft palate. Let's proceed. Maybe next question is number 41. The care of a patient with pressure ulcers include A. Providing a cardiac bed. B. Massaging reddening areas for patient's skin. Use of a puff sheet when moving clients in bed. D. Having the patient sit on a definite type of device. Attempt number 41. So 41D from AD, Emma, Lily, Maya, Rita, RST, Hollet, Mukami, Levodopa, Njoki, Mwangi, Kesos. Marion, kindly number your work. Is Musa, Sandra, Mamu. So 41D, the care of a patient with a pressure ulcer includes having the patient sit on a definite type of device. What are the other cares for a patient with pressure ulcers? What are the other? What of B? What of B? So what does B read? Massaging reddened areas of the skin. Massaging the reddened areas of the patient's skin. So other managements of patients with the pressure area ulcers is 2-hourly turning. Is there any other? Somebody to share a pictorial evidence of a picture we can you can do wound dressing and cleaning to the already ulcerated areas. Kuna evidence massaging is contraindicated. Is I think massaging will bruise the area and cause ulceration. Is it true? Hii ripple mattress ndio. So there is a pictorial evidence shared by us. Mimi sasa nitakuwa nakuita us. So us amtutumie evidence. What about cardiac mattress? Cardiac mattress ni gani? Ni kama ile ya cholera. Na hiyo ya cholera ni gani? Ya cholera iko na shimo. Yenye iko na kashimo. Ile yenye mtu akidenki na inateremka. Ebu somebody to also share something, pictorial evidence of the same. Mbio alafu tuendelee. Nini natoa C? Let me see. C, what does C say? Use of a puff sheet when moving client in bed. Oh, I think watu wa C wameamka. So we have Wekesa and Claudia going C, and also Mali. Okay, watu wa C, mbona mlikuwa mmenyamazia ansa zenu jamani? Usinyamazia ansa yako. Tokea na ansa yako na utetee ansa yako. So C, we have people going in C, that is to use a puff sheet when moving plants up in bed. So puff sheet is more of a heating type, like the ones used to warm patients with hypothermia. That is from Black Potion. Thank you for that insight. Hiyo cardiac mattress walai. Hii ni cardiac mattress kweli mzee? Ama hii ni ya newly married couples? Hiyo ni watu wa honeymoon jamani. We have cardiac bed. Thank you for sharing this painkiller. So this is the least strain and also help in relief of dyspnea. You can see. Walai, health is expensive. You should know that your health is very expensive. Don't joke with your health. Eat healthy, do exercise, walk, fast, do everything that can make someone healthy. Health is very expensive. Situsiti ama kuna issue. Is there any concern before we continue? Is there any issue before we proceed? Any concern? If there is no concern, you can forward. Oh, why not see? I thought Black Potion alikuwa amejibu. Thank you. Yes. Somebody to share some notes on management of ulcer areas, pressure ulcer areas from Brunner's. During this, sessions, you should keep Brunner's close. Oh, he was not sure. Black portion is not a he, ni she. Hebu mtume some evidence from Brunner's jamani. Leteni some notes from Brunner's tupitie mbio mbio. As grabber hii ishatumwa. Tuma evidence from Brunner's sasa. As. Kathi umerudi. Naona tu time imeisha, so maybe tunaweza maliza tu. Management of pressure ulcer areas from Brunner's. Oh, it's okay. Too many mbio mbio jamani. Tuko wengi. You are wasting time. We are wasting time. We are 200 participants. Black portion is a ha with kindly Wekesa convince us. Wekesa convince us that the answer is C. So we have some evidence shared by Hams. So let me see. Patients at risk for pressure ulcer development include all patients with alteration in intact skin, such as dry skin, excessive moisture, or older age, increased friction and shear, and altered mobility. We have decreased sensory perception. Hizi vitu ziko blurry. So frequent skin assessment, regularly assess each patient's skin for redness or changing color, dryness or excessive moisture, blanching response, localized heat, edema, hardness, areas of discomfort or pain that may be related to pressure changes to relieve and redistribute pressure. Avoid friction and shear. Lift. Do not drag the patient. Do not drag the patient. Reposition using the 30-degree tilt side lying position or the prone position. When possible, avoid the 90 degrees side lying position or the semi-recumbent position. Use pressure relieving surfaces. Do not turn an individual onto a body surface that is already reddened from pressure. Do not use massage or rubbing for pressure ulcer prevention. Sioni vizuri. Use emollient to dry the skin or to hydrate dry skin, sorry. So nutrition for pressure ulcers prevention. For patients with nutritional risk, offer high protein supplements between mealtime in addition to the usual diet. Thank you for sharing that. Massaging the area improves tissue suppleness, reduces swelling due to accumulation of fluid, and boosts immunity, hence prevent further development of pressure ulcers. Nanok, I've just read some evidence that discourages massaging. A definite device should not be used as the edges creates a high pressure zone that can damage tissues. A cardiac bed upon elevation can increase shearing forces and also pressure on the dependent part, hence predisposing to pressure ulcers. Oh, tuna CTC. Okay. Kindly share, forward the next question. Kwani upepo umebadilika saa ngapi jamani? Kindly forward the next question. So ni 41 ama 42 jam? Ni 41 ama 42? 42. Okay. So 42, autograft A from a cadaver, B from another species, C from burned gland to his or her burned site, D a synthetic source. So you guys are going with C. C inasemaje? From a burned gland to his or her burned site. What about from a synthetic source? What about from a synthetic source? What about from a synthetic source? You guys, are you able to hear me? You can share something so that we have from identical twins. I think that evidence is very clear and very helpful. Let us proceed. Let us proceed. You can save that. You can save that evidence so that you can go through it now and then, every time you want, anytime you want. Edema occurs in patient number 43. Edema occurs in a patient with congestive heart failure because of A. Falling tissue hydrostatic pressure. B. Rising tissue colloid oncotic pressure. C. Rising plasma hydrostatic pressure. Data bring Kim, Lily, Harriet, Laisha, As, Bandit, Walter, Njoki, Alain, Maya, Maggie, Nadine, D, Kesos, Big Fish, AD, Miss Feli. AD ushasema hadi CT. Relax. Miss Feli, Tara, Mo, Bozi, Evidence, Mizi, Limek. Kuna majina Wekesa. It can't be D. What is your answer, Black Potion? D inasemaje? Falling colloid oncotic pressure. Actostaphylos. Mkona majina huku. What? Oh, you are still brainstorming. You are still brainstorming. Okay. So most of you are going with D. That is falling colloid oncotic pressure. You can share some evidence so that for the sake of we have B. B ni rising tissue colloid oncotic. Edema ina albuminemia ama albuminuria. Ilikuwa asubuhi ama was it in the morning that we did something on albuminuria? Black Potion, you can explain. You can unmute and explain. 2 minutes.
Okay, but hata 2 minutes ni mingi. Okay, the uh where we can have edema due to a fall is in oncotic pressure is because of number one is when we have hypoalbumin of the albumin and the plasma proteins from the blood vessel to the tissue. Then that will be responsible for the colon-oncotic pressure. That will cause the shift of fluid from the blood vessel to the tissues. Tunakuwa na pooling in the blood vessel, like blood doesn't flow back to the heart well, and the heart does not pump the blood out of the heart well. So when the bouncing between these fluid will increase the pressure, that is the hydrostatic pressure, and which will cause this fluid to move from the blood vessel to the tissue rather than the colon. Colon does not cause the edema in this situation unless it's when the albumin is a problem or when we have sepsis and immune reactions of any sort. That is when we will have the oncotic pressure causing this type of edema. Yeah.
Thank you very much Black Potion for that insight. Mwenye alikuwa anasema Black Potion ni thank you very much Holet. So we have two major mechanisms, that is hydrostatic versus oncotic pressure. So hydrostatic pressure increased pressure inside vessels, pushing fluid out, that is edema. On the other hand, we have oncotic pressure, low that is causing edema. So hydrostatic pressure push out capillary interstitial liver cirrhosis, we have chronic kidney disease. Oncotic pressure, plasma proteins, that is albumin protein reduces, oncotic pressure reduces. Less fluid pulled back into vessels. Fluid remains in tissues, causing edema. Causes, we have liver cirrhosis, we have nephrotic syndrome, we have malnutrition, that is kwashiorkor. So in conclusion, hydrostatic increases, push in. Let's do the last question. You can save that, you go and read further. A patient's apical heart rate, the nurse places stethoscope on to evaluate a patient's apical heart rate. The nurse at mid-clavicular line between third and fourth intercostal space. Wow. Can we do up to number 45? So we have B. Kila mtu B. Point of maximum impulse. So what does B say? That is left side at. What's the mnemonic of the anatomical location of those valves? What was the? Thank you. Mid-axillary ni gani? You can share pictorial evidence so that it can be easy to note. Nataka nimalizie number 45 if you allow me. Cantona. So you can see from that pictorial evidence where various sites are. So we have aortic area, we have pulmonic area, abs point, nini on the left, on the right, I mean. Abs. Ama. Later. tumalizie hapo. I wanted to do number 45 as the last question, but I wanted to do number 45 as the last question. Nadine, ushachelewa. Wait. Many watu wengi wanasema tumalizie hapo. Which of the following is a sign of meningitis? Hata ni rahisi. Which of the following Brudzinski sign? 45B. Everybody is calf when you dorsiflex. Then B and D. Then Hager sign ni ile Hager soft. Nani yule wa Hager soft? That is somebody that Shekina aone. The most correct is D. Positive when passive neck flexion causes involuntary hip and knee flexion. Also indicates meningeal irritation. Okay, and legs ski sign. Canic and legs ski sign. Canic sign ski sign is tumalizia and D. And also used both meningitis and sub. Whoever was updating the score sheet, I want to thank you. Thank you, Kathy. Thank you, Kathy, for taking us through. Thank you, Kathy, for taking. Thank Kathy also. Thank you, Kathy. We are now shifting to unit wise. Which unit are we doing today? Which unit are we doing now? You can now shift to unit wise. Ni unit gani, Kathy? Adult nursing. I will share the welcome everyone. Leo nimeomba hadi network ikakuwa sawa. I think I'm becoming the chosen one.